Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. Well, today we have a very special guest, Dr. Joel Bonaparte. He is double board certified in pediatrics and neonatal perinatal medicine. He completed his residency to Weill Cornell Medical College, Lincoln Medical and Mental Health Hospital, New York, and fellowship at John Stroger Jr. Hospital of Cook County, Chicago, Illinois. His passion is to provide the ultimate standard of care for over 15 years, both in the clinic and the NICU, has been his philosophy of practice. He has been the president of Sunrise Neonatal Associates and the neonatal medical director at Oak Bend Medical Center since 2017. To taking care of the full spectrum of sick and well newborns to adolescents. Welcome, Dr. Bonaparte. We're happy to have you today.
Thank you so much for having me, and I'm really excited to be on your podcast today.
Well, we're glad to have you. So I have a bunch of questions for you today. What is a neonatologist, and how does it differ from a pediatrician?
So, excellent question. So a neonatologist is somebody who was finished medical school, then decided to do pediatrics, so completed a 3-year residency in pediatrics, which is general practice of kids from 0 up to age 18, and then decided to further subspecialize in perinatal neonatal medicine, which is an extra 3-year fellowship program. Some will come out as general pediatricians and practice for a few years before going back, and some go directly from residency to fellowship like I did. And it is a very rigorous training where it is focused really on the care of the sick newborn, preterm babies, and every aspect of complications within the perinatal and neonatal period. The neonatal period is really the first 4 weeks of life. But any baby that is born and kept in the NICU typically is seen by the neonatologist till discharge. So that could be 3 weeks, it could be 6 months, all depends on the complication of the case. But that case will be under neonatal care till discharge from the hospital.
You were really dedicated in starting a NICU at Oak Bend. Do you want to tell us exactly what a NICU is and what level Oak Bend is? And then what that means for our community.
Okay, so a NICU is a designated area within the perinatal department kept specifically for newborn babies that need extra help. So NICU stands for Neonatal Intensive Care Unit, so it is a very specialized unit. And as a unit, obviously it's made up of a group of things. The first most important thing would be the staffing. So at Oak Bend, we have 3 board-certified neonatologists on staff 24/7. We have experienced RNs, which are NICU nurses that take care of our little miracles. And then we have ancillary staff, which is so important. So we do have a powerful respiratory therapy department who are well vested in taking care of the newborn that needs any help. They do all the tweaking on the machines, which are ventilators, CPAP machines. We do have warmers for the babies as well as incubators, which we now call isolettes. And all these are very, very important for the care of the sick newborn. We do have ancillary staff, including radiology. They're available to do ultrasounds for emergencies as soon as possible and read by a radiologist within the first 30 minutes of any emergency. We are supported also by a cardiology team from UT, where we can get echocardiograms done as soon as necessary when needed within 30 minutes and get a reading within an hour, which is really awesome in a small unit like Oak Bend Medical Center. So these are some of the things we have that all work together to make our NICU a very successful place to keep sick babies.
Why is it so important to have a NICU at Oak Bend and in this community?
Very good question. I think there are 2 main reasons. First one really is the geographical location of Oak Bend Medical Center makes us the first hospital in the corridor coming up from 59 South, so further from Wharton, El Campo, Meadville area. As you're coming up, we're the first hospital you will see. And I think it's so important because some mothers that are being transferred from down there for various reasons could not be taken to the medical center. They could come to Oak Bend because they're quite acute, or delivery of the newborn is imminent. So having a NICU in that geographical location is of a great advantage because many of the mothers show up there, and we have the staffing that could take care of any baby less than even 32 weeks, stabilize and transfer. Oak Bend Medical Center per se is a level 2 designated NICU, which means we can take care of babies 32 weeks and above and greater than 1,500 grams. But putting it into perspective, everybody wonders what a preterm baby is. A preterm baby is any baby born less than 37 completed weeks. And we're very well versed in taking care of these babies. The second reason why I think a NICU is so important is we have to bear in mind that percent of all deliveries will require some kind of help. The babies come out, they've been in utero, having fluid in their lungs for 9 months, and they come out, and many of them need some help during that transition period. So 10% of them will need help, and out of that 1% will need resuscitation, which means positive pressure ventilation plus or minus chest compressions. And this is readily available at Oak Bend Medical Center. And then we also have to bear in mind that all of us try not to have our babies in the NICU, but the truth of the matter is 5 to 15% of all babies will end up in the NICU, depending where you are and depending on the risk in the environment that the patient is being born in. So these two major factors make a NICU at Oak Bend so important. So when a mother is delivering, she knows she has that extra comfort that you have specialists in the house to take care of your baby. If your baby needs transfer, you have specialists available to stabilize and transfer the baby in a good and stable way.
And it's so nice to be close to your baby.
Yeah.
If you go home and your baby stays, which most preemies do, and if you have children at home, it just gives the mother a level of comfort. So that's great.
I think that is a great point that I need to expound on as well, because our aim at Oak Bend Medical Center is to give quality care close to home. So like I did mention, 5 to 15% of babies might end up in a NICU. You can imagine without the NICU, all those babies would have been transferred out, and those mothers will be separated from their babies geographically, and not to mention the traffic, parking, and all other things you have involved when a baby goes to the medical center. But having a baby close to home lets the parents engage more with the baby. They have easy accessibility, and it's well documented that babies that have that continuous care from the mother, having, the mother putting the baby on the chest, having skin to skin, have better outcomes. So it really helps the community and Fort Bend County as a whole.
Great. So what type of support services do y'all offer in the NICU and in the hospital for the parents?
Very good. So there's several levels of help we can give to the parents. First one is really prenatal. The neonatologists are available to the OBs to give prenatal consults. There's some mothers that have been predestined to have their babies a little early. They can come to the unit and we go talk to them, tell them what to expect, answer all their questions, alleviate some of their stress level, which I think is really important. And then after the baby is born, we do have several levels of support. We have social workers that engage with the parents because it's a tough thing to be separated from your baby if the baby ends up in the NICU. Social worker really helps them with that. We have a chaplain available who is on call. Some people just need that extra help as well. Very important to mention, we do have a breastfeeding consultant who can help the moms because that separation affects the breast milk production, and she can really jump on it right away and help them with pumping until the baby is stable enough to go on the breast, because the baby is the best inducer of milk production. We all know that, but she helps them and guides them through that process. And then we do have physical therapy, occupational therapy, and speech therapy team that help babies that have issues with feeding, and they work with the mothers hand in hand. So that's a very good advantage. They come when the mother is available. They teach the mom how to hold the baby, how to feed the baby, apart from doing the regular assessment of the baby when it comes to tone and reflexes and things like that. So I think that is a very, very big help. And then the last one I'd like to mention is rooming in. Rooming in is a concept where babies that stay in the hospital for a long period of time, we generally say 1 to 2 weeks or more. Prior to going home, we allow the mother to room in with the baby off monitors when the baby is stable, and they spend 24 hours together in a room where they're very comforted that the baby is stable enough to go home. With the era of COVID-19, that was put on hold a little bit, but that's going to open up very soon. And that is one support system that I think is very vital to babies prior to their going home for the family.
And I want to thank you for helping put this program together. And there's a whole team of y'all that get together and meet and work on making things better and changing things. You and the OBs work closely together. It's quite an impressive team.
Thank you.
But now I understand that these mothers that have these babies with you and bond can also use you in an outpatient setting because you have a pediatric office.
Yes, we do. So we have a pediatric office called Sunrise Pediatrics. One is on Westheimer and Kirkwood. The other one is in Sugar Land, pretty much on Town Center Boulevard. So quite close to home. And the highly acute babies sometimes need further follow-up, those that have issues that need to be watched closely. And we tend to see some of them in the clinic, which is a great help. Mothers are very confident that it's the same physicians who saw them in the hospital or in the NICU see them again in the clinic. And there's continuity of care, which I think is really awesome. So we're very open to seeing patients that need that extra help in our clinics.
But you don't even have to have your baby in the NICU. You also see patients or babies that have born healthy to what you said, 12?
To 18.
To 18.
So we see all babies, well babies, those that have issues, and we take good care of all of them. We have all the vaccinations available and ready referrals for anybody who needs any referral. So our clinics are very engaged with well baby care, following babies for jaundice, things like that, and also those that need specialized care as well. We take care of them.
And I guess the immunizations, the colds, the flu, the whole thing.
Yes.
So can I ask you a very controversial question?
Okay.
We hear now that they're suggesting that children 12 and over get COVID vaccines.
Yeah.
How do you feel about that?
I think that the science is moving towards us all realizing how safe these vaccines are. And once the prudent science has come out, I see there's no risk, really. And I'm just even hoping that as they do further research, these numbers will come lower to, take hold of kids 6 and above and even go down to babies 6 months and above. There is enough evidence to show that the new mRNA vaccines are really, really good. They're giving long-term immunity, and I am very comfortable giving them to our kids once it becomes available to even lower ages.
Wonderful, because I was watching the news the other night, and there's all this controversy, and it becomes confusing, and we all want what's best for our children.
That is a good point, because pediatricians, neonatologists, we all have kids too. And I can guarantee you, I talk to many of my friends, they're getting their kids vaccinated. So, we love our kids too. The fact that your pediatrician is vaccinating their kid gives you a window of protection that they really, really think it's good. So I think the whole community needs to take cue and follow with that lead, because in the long run, our ability to vaccinate more people decreases the risk for different variants coming out, which seems to be the problem for the future. So I think it's a good push, and I'm very much in the forefront for advocating for immunization of kids.
Dr. Bonaparte, if there was one thing you could tell us about children or what we needed to do for their growth and all that, what would you tell us?
I'll tell you
what advice
about their growth and all that. I think the most important thing to realize is there's so many high-calorie drinks out there. We're seeing this epidemic throughout, where they're getting overweight because of all the juices and sodas. And really, we're really trying to curtail that. So more exercise, less juice, less sodas, And I think we'll all do much better. I think really that's my biggest thing.
More sunshine and less video
And
games?
less video games, obviously, and less TV. With COVID, that's what the problem was. Everybody got so comfortable staying home and playing video games, and it's going to be hard breaking that cycle, but I think we need to get them outside, let them run around again. Things are getting better. I think there's light at the end of the tunnel, and activity is so important in children. So we need to get back to that.
So that's a good question. So if you have a child that is a little obese or something like that, is it a good idea to get them in with the doctor and you and the doctor kind of discuss a plan?
Yes,
for them?
that is so important, because at some point, kids, at certain ages, they don't want to listen to their parents anymore. There's also that extra respect they have for their physician, especially if it's a physician they've seen for a while. So that one-on-one talk with the kid always seems to have a little more response. I think it's very important. You come up with a plan, we sit down and see what the likes and dislikes are, and you have to curtail it specifically to the patient that you're seeing, because everybody's wants and needs are a little different. But that is so important, to have that interaction with your physician and formulate a plan and just keep on that kid. You see them again, make sure they're following the plan. If they've fallen off, you talk a little bit about it, and that helps to keep them on track in the long term.
And that will prove to have healthier adults later.
Yes, it will. Yes, it will.
Okay. I encourage everybody that hasn't had a chance to meet Dr. Bonaparte, if you have a child, you're looking for a doctor, please see him. He is a wonderful man and does some great things with kids and adults. Dr. Bonaparte, I want to thank you for joining us today. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus. Doing your life as the greatest person you can be in all situations. Please join us next week. And Dr. Bonaparte will be putting your number, your office number, and address locations on our website. So if people are interested, I encourage them to call and make an appointment. Thank you.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.